Surgery for bladder prolapse and bladder leakage is very common because these conditions, bladder prolapse and bladder leakage, are common conditions that affects millions of women. And you may be a woman listening to me right now. You may have noticed that all of a sudden you have to lean forward or lean back, empty your bladder to maintain your urine stream. You have more pressure in the pelvic or vaginal area. You have to push up a bulge to empty your bladder or to maintain your urine stream. You've noticed maybe some low back pain towards the end of the day. And you may have noticed some bladder leakage, either with not making it to the bathroom on time, with some urgency. You have to run there, gotta go, or with activities like laugh, cough, or sneeze, and you try to jump on a trampoline with your children and you've noticed that you can't. Don't be embarrassed by these conditions. These are very common conditions that affects millions of women. Know that nowadays, thankfully, there are good, safe, and effective solutions to improve your quality of life, your comfort, confidence, and control. Now, you may be a woman listening to me right now where you're planning to, or you're actually scheduled to have bladder surgery for bladder prolapse or bladder leakage, or you may have just had bladder surgery. This video is for you because in this video, we're going to talk about things to avoid during the recovery process so you can heal your best during surgery. And be sure to watch to the very end because I'm going to actually be sharing some bonus tips as to how you can recover your best during surgery. I'm going to share some tips at the very end, so be sure to watch to the very end. And if you have not subscribed to my YouTube channel, go ahead and hit that subscribe button right now and hit the notification button so you can be notified of future videos in the future. So when I talk to my patients about, post-op recovery from bladder surgery for either a vaginal bulge, bladder prolapse, or bladder leakage, I typically advise and help them remember by saying 2 days, 2 weeks, 2 months. So think about it. You go home the same day typically or the very next day. And then the first 2 days, walking and stairs are fine. However, you want to avoid driving initially for the first 2 or 3 days until the swelling goes down, until you can get behind the wheel safely, drive defensively without being uncomfortable, because this is bladder surgery. So there's going to be a lot of pressure down below. And so you want to avoid driving too quickly or too soon until that swelling goes down, until you're more comfortable, preferably off pain medicine, until you are able to drive safely, defensively, short distances initially. So yes, after the first 2 or 3 days, you can then resume driving. Before that, you want to avoid driving too soon or too quickly. I typically say walking and stairs are fine, but you want to avoid running and up and down stairs too often. You want to avoid lifting anything heavier than 10 to 15 pounds. Anything below 10 to 15 pounds is typically fine. And I usually say a gallon of milk or a gallon of water is about 8 pounds. I typically tell my patients to lift no more than what would seem like a gallon in each arm. Lifting more than 10 to 15 pounds, you want to avoid that because that can lead to more discomfort, more pelvic pressure, and you feel more exhausted. And hopefully, in the worst case scenario, is lifting something too heavy that actually pops a stitch vaginally, and that can affect your long-term repair. Walking is also good because it helps to keep the circulation going and helps to minimize the risk of blood clots, or DVT, we say, deep vein thrombosis. So you want to avoid not moving at all, being in a chair or being in a couch for a long period of time or in bed for a long period of time without moving is not good. So you want to avoid that. It's important to avoid excessive straining with bowel movements. So oftentimes I'll have my patients take stool softener. A lot of women will do something more natural, make sure they're getting enough fiber, drinking enough water, getting enough movements. That's all good for normal bowel control. To avoid excessive straining, that's one thing we want to avoid to help to prevent any undue strain on the sutures and the repair that may affect the outcome of your bladder surgery. Now, showers are fine. However, you want to avoid, getting those incisions immersed in water. Now, granted, with vaginal surgery, those incisions are internal. However, there are sutures there, and we don't want those incisions or sutures to get immersed in water. So you want to avoid tub bath, swimming pool, jacuzzi, lake, hot tub, saunas, anything that's going to create undue moisture, swimming in a pool, lake, or bathing. That you definitely want to avoid to help to prevent water from getting those incisions immersed in water and preventing the outcome of your bladder surgery. Usually by 1 to 2 weeks, women feel great on the outside, but there's still a lot of healing still going on the inside. You have a lot more energy back, swelling's down, you're not taking anything for discomfort typically. And so it's easy to start to do more things. But I tell my patients, the sutures are still healing. So you really want to still keep to those instructions. And one of the things I tell women is that other forms of intimacy outside the vagina are fine, but we don't want anything inside to disrupt any of the sutures, understandably. And so avoiding anything, of course, especially in the vagina or any instruments inside inside the vagina will help to prevent any of the sutures from being disrupted during the healing process of your bladder surgery. And then by 2 months, so anywhere between 6 to 8 weeks, usually all the incisions have healed, the sutures have dissolved, and then you'll be able to resume all your activities without restrictions, typically by 2 months. So 2 days, 2 weeks, and then 2 months. Imagine how you feel when your bladder is no longer prolapse, you have better support, you're more comfortable, the bladder leakage is not there, you have more control of your bladder. And so these are things that once you cover well and avoid those things during the recovery process, that's going to ensure that you get the best outcome from your bladder surgery. So now you've watched to this point of the video where I said I was going to mention some bonus tips for how you can recover optimally and well with your bladder surgery for either prolapse or incontinence or bladder leakage. And so one of the things you can do, one of the first tips is adequate movement. Walking is good. Even though you can't run or do heavy exercise, walking is good, helps to keep circulation going. It's good for bowel movement because that circulation is important for normal, regular bowel movements. It's going to be helping to prevent blood clots. Very, very important. And it's also going to help you feel good. You'll get outside, get some sun. It's great for your immune system. So walking is great. It has many benefits, and that's going to be helpful in terms of your recovery from bladder surgery. Getting adequate sleep and rest is good, and you may actually want to squeeze in a nap or two during the day because you're going to understandably be tired. However, getting that enough sleep is going to be good because that's going to help you feel rested. That's going to help you with the healing process because your body's not going to have the same energy and vigor that it once had before your recovery because it's concentrating on putting energy and effort into helping you recover. So do take that nap if you need it, and do get a good amount of sleep, and that's going to really be helpful to help give you the energy you need during the day while you recover. And the third tip that's going to really help you recover the best from your bladder surgery is adequate nutrition. Fruits, vegetables, fiber, that's really, really going to be good for bowel movements. Getting enough protein is going to help you with, building and help with repair. Taking a multivitamin, a good comprehensive multivitamin, omega supplements, that's all going to be good to help with your immune system. That's going to help with healing, help with your joints, help all of the things that you need for your movement, for your bowel movement, for your mood, for your sleep. All of that's going to be, and to help with repair and help with healing and getting that energy you need. So getting a nice balanced nutrition with supplements, nutrients, vitamins, all the things that's going to be good for your healing process. So these are 3 tips that are going to really, really be helpful. That's going to help with your healing process from your bladder surgery. And if this video has been any value to you, like it, share it, and comment at the bottom of the video. Let me know which part of the video did you enjoy the most, but which one of the things to avoid do you think would be easy to avoid as you recover from surgery? Or if there are any other suggestions, are there things that you think women should avoid as they recover from bladder surgery? You may have had surgery, and so what additional suggestions would you give based on your experience that really helped you as you recover from your bladder surgery? Comment below. Let's get a conversation going so we can help other women also benefit from these tips to help women recover from bladder surgery for either prolapse or incontinence well. So thank you for watching to the very end. Dr. Tugbiyele here, board certified, fellowship trained urogynecologist, top doctor in Atlanta for urogynecology. And if you are looking for an expert in urogynecology and who will take care of your prolapse, either bladder prolapse or bladder leakage, and also guide you through that recovery process, I'll make sure that you're getting the best outcome from your bladder surgery for prolapse or incontinence, I invite you to work with me. And one of the ways you can reach me is through my website. That's www.drtugbiyele.com. Link will be in the description. And that'll take you to my website, and there will be an inquiry form that you can fill out that'll get to my team and who will help you make an appointment to see me. Or you can reach me directly from my office number, 470-325-1280. And imagine how you feel once you've had your bladder surgery for either drop, prolapse, or vaginal bulge, or for bladder leakage, how you'll feel better, your comfort's back, your quality of life is better, your confidence is back. You don't have to avoid going outside and running and exercising, jumping on a trampoline with your kids. You don't have to avoid social activities because of your prolapse or because of the bladder leakage. All of these things are possible for you when you work with me. So I do invite you to work with me, drtugbiyele.com and 470-325-1280. I'll see you in the next video.